I want to talk to you about something I'm seeing with young adults and actually middle and older adults too, that I think has been mislabeled for years. And so couples dealing with it don't really understand where it's coming from. They end up calling it generalized anxiety or depression or bipolar, and it's none of those. It's something that we oftentimes see in children. In fact, it usually presents in children 6 to 7 years of age, and during that time, over 50% of any anxiety that shows up is actually separation anxiety disorder in children. But what we don't talk about is how this doesn't always go away. And in fact, young adults, older adults are living with it, and they don't know what it is. They just know what they're feeling. So separation anxiety disorder in adults is different for men and women too. So I'm going to get into that, but I just want to start generally with how it looks. Number one, it has a fear of abandonment. Adults with separation anxiety may constantly worry that their partner will leave them. This fear can make them appear kind of clingy, or they can need frequent reassurance, and they're often testing their partner's commitment. Overdependence. People that have this separation anxiety disorder are overdependent on their partner, putting a lot of pressure on them. And this is emotional dependence. So they struggle to function secure when their partner's not giving them approval. They control or monitor. They basically are trying to control their partner's behavior. So they're suspicious about whereabouts, and they discourage independent activities of their partner. They have distress during absence. When their partner's gone and they don't know where they are, it can trigger anxiety, panic attacks, or depressive symptoms. And there's a real relationship strain because, of course, their partner feels smothered. This person is always needing them, attaching to them, and they don't understand why. Their partner will tell them really sweet things like, "I don't know what I'd do without you." This is the stuff of romance novels, but it's not romantic. It can feel overwhelming to the partner who has this person with separation anxiety disorder. Where does it come from? It comes from early childhood experiences, loss, trauma, neglect, or attachment issues, insecure or anxious attachment styles, whether that was modeled by a parent or that person developed that a little bit later in their own life. And other mental conditions like generalized anxiety or borderline personality disorders can all get in the way of actually separation anxiety disorder getting labeled correctly. So can it be treated? Sure, it absolutely can, with cognitive behavioral therapy, challenging those anxious thoughts and behaviors, or attachment-based therapy, like exploring relationship patterns of your past and your current relationships, medications sometimes to calm the anxiety or depression that the client is also feeling as a result of separation anxiety disorder. And if you practice mindfulness and coping strategies with them, then it helps them it helps lower their separation anxiety because they do feel like they have healthy coping mechanisms that can help sustain them when they're not getting that reassurance constantly from their partner. So in women, this looks different than in men, okay? So the first thing that I want you to know in women is that they may communicate their fears as abandonment. That's more likely. They'll say, "I feel anxious when you're not around," or "I don't know what I do without you." This is all women lingo for dealing with this. Seek constant reassurance. Women need you to kind of send texts all the time, check-ins. They may need validation that their relationship is secure, that you still want them. Women also may experience guilt or over responsibility. They may feel guilty for being too needy or too burdening on others, or they might internalize distress, leading to more anxiety or depression. And they overfunction in the relationship. They try to keep someone close to them by overextending themselves. So they're trying to please their partner all the time. They're trying to earn that love and that place with them. They can develop codependent patterns because they're trying so hard. Separation anxiety in men looks different. They control or withdraw instead of expressing fear. Men are more like openly scared of being left. They may say something like they'll act controlling. Why are you always going out with friends? Or they'll withdraw to avoid vulnerability. So a guy isn't going to tell you that they're scared. Instead, they're going to act in a controlling manner that kind of makes you feel guilty, or they're going to withdraw because they don't know how to express that vulnerability or fear. They may get angry or irritable. They may be frustrated or anger instead of having sadness or fear. For example, if a partner makes independent plans, a guy who has separation anxiety disorder will feel hurt, but he'll respond with an accusation or coldness. And you'll see this pattern blatantly, but still you won't link it to separation anxiety disorder. And so once again, we're not helping with the labels because the guy has he's functioning as his brain tells him. His brain won't admit he's afraid. So instead it says, I should be angry. I should be mad at her. An over-reliance on a partner without admitting it. So they may resist being alone or constantly seek the partner's company, yet deny that they need them emotionally. And because of their fear of vulnerability, this may lead to making them anxious with those thoughts. But instead of saying, I feel anxious, they're going to use their intellect, their logic. And what that's going to do is help them dismiss their vulnerability. So it makes perfect sense how they respond to that. But once again, if we knew what was causing it, we could get to the bottom of it and actually help it. And they may just end up sabotaging the relationship out of a fear that they're going to lose it. And because they don't know, how they'd handle that, they want to almost have control over it. So we see that a lot. They'll break up because they're actually afraid of losing the person. Just remember, with this disorder, both genders have panic and anxiety at the idea of being away from the person they're attached to. They may have sleep disturbance when they're separated. They have difficulty focusing at work or socially when the loved one is not there or is threatening them not to be there. And basically any conflict, or I won't say any, I shouldn't say any, but I will say 80% of all conflict is driven by clinginess or fear of losing each other. Once they're in therapy, we can assess that, see it, and strategize. But when you're not in therapy and you're just trying to figure it out, don't forget separation anxiety disorder, because it is a real thing. I see it a lot. And if you give a label to it so that you can start using your words, it's going to really help you minimize that anxiety. If this video is helpful for you, please subscribe. If you're already a subscriber, thank you so much.